I'm Troy Schneider with the New America Foundation, and we're talking about some of the 10 big ideas that our organization is proposing. And with me today is Lynn Nichols, who directs our healthcare program. Thanks for sitting down to talk about your plans for comprehensive health insurance.
Glad to be here, Troy.
So you're calling for healthcare reform that would bring mandatory, affordable health insurance for all Americans. What, in practical terms, what does that mean?
It means every American would have access to the kind of care that they should have access to. That's care that makes them better and helps their health improve. And it also means it would be affordable for every American, so it wouldn't tax the budget of anybody, and fundamentally it implicitly means the system would be sustainable so that we could afford it as a society as we go forward.
Okay. Getting to the specifics of the plan is something important I want to touch on quickly, because the layman will come to this and say, well, gosh, if the costs are increasing at 3 times what our productivity is increasing, and employers can't cover it, and you hear about the shortfalls in Medicare and Social Security going forward, the government's having trouble meeting these. How is any sort of rearranging of the system going to let us pay for it? And so I'd like you to talk a little bit about what the big steps are to move this forward. Your paper sketches out the idea of requiring everyone to purchase health insurance as individuals to get the employers out of the game while hopefully keeping some of their money in it. And then I believe you talk about financing it with a dedicated tax of some sort.
Right.
So
well, first, let's get back to how we afford it. I mean, fundamentally, we're not going to be able to afford it whether employees are in the game or not unless we get better at buying health care smarter. We now essentially get high-quality care about half the time. And part of that is because we're simply not aware of the outcome, the impact of the care that is delivered, because we don't have an information system that allows us to record and monitor it systematically. Physicians try lots of things. Most are well-intentioned, most are very smart, most are well-trained. But they're basically pushing things around in the dark, and they don't know if what they're doing actually systematically has the right outcome. So what we need is comprehensive reform that enables us to monitor and set incentives so that the right care is delivered to the right patients the first time and no more and not late. So doing that requires systematic reform. If we don't get that under control, we're never going to be able to control costs. How do we arrange the financing structure? Well, like we just discussed, with healthcare costs being such a large part of average workers' market productivity, it's very difficult for a firm to be able to pay for that out of the market value of that worker. Ultimately, it comes out of wages. And so fundamentally what you're doing is denying individuals living standards that they could have otherwise if we weren't stuck in this very inefficient healthcare system. The employer ultimately has very little to do with why healthcare costs grow. So getting him out of the way is irrelevant to that trajectory. The reason to get him out of the way is so that our economy can compete internationally, and we sort of move that off the table. Then you bring it back to how are we going to pay for it? Well, it seems to me an American system, one that will resonate with our values and one that will work in our institutions and with our culture and our history, has to start with individual responsibility. We believe every person should be responsible for themselves. At the same time, we are aware that not everyone can afford to pay for this stuff on their own, and not everyone has all the information they need to make the best choices in the complicated healthcare system. So there's a community responsibility or a social responsibility as well. So that combination of individual responsibility and shared responsibility are the philosophical cornerstones of this plan, and that means we require individuals to go out in the private marketplace and buy private insurance. Again, we emphasize private marketplace because we want choice, we want private sector innovation, we want freedom. At the same time, we want that marketplace to be fair and efficient, so there will be rules in place about how much you can charge different kinds of people, that sort of stuff, what kinds of products you can offer. But given those rules, we want the market to have a whole lot of freedom because that's what serves us best. At the same time, we're going to have subsidies for the low-income population, and the government's probably going to have to play a role in gathering and disseminating information so that individuals and their clinicians can make the right choices about what kind of health care is best for them.
One last question. That there's been a lot of news coverage over the last several days, especially, but in recent weeks, first in Massachusetts, now in California, that the states are tackling this issue. And two questions. One is, what's your initial reaction to those proposals? And the second is, how does that tie into the national debate?
Both Massachusetts and California, on opposite sides of the country and with relatively different political climates and certainly different facts on the ground in their healthcare system, both of them have adopted a model quite similar to the one I advocate and the one that I think makes the most sense, and that is individual responsibility, individual mandate, requirement to purchase, in a context of shared responsibility where low-income people have help from their neighbor and a market is made efficient so that everyone can buy a fair and efficient price. So the models of doing it are actually quite similar to our vision, and therefore I think they're both wise and sustainable. The political context in Massachusetts is interesting because there you have a Republican presidential aspirant, not one of the five, by the way, who came to me earlier. So he's, they're doing it independent of him. He basically said, I want to cover everyone. And there you had a Democratic legislature willing to accept the word limit. So a Republican using the word all, a legislature from the Democratic side using the word limit. Those are things around which we can build a compromise. In California, you have another Republican governor who basically had been saying for quite some time he would never raise taxes no matter what. And he looked at the healthcare system. We've been working with him behind the scenes now for almost 2 years. And he always fought hard against the conclusion that he had to go out and raise new revenue. But he basically concluded that, in healthcare's case, the investment is worth it. And again, his plan is based upon individual responsibility coupled with shared responsibility so that individuals can get help if they need it. But no one in California, even immigrant children, are going to be allowed to go without health insurance and access to health care. Now, those two examples are wonderful examples of how states themselves are truly frustrated with waiting for Washington to do something. Washington has been stuck in an incredible paralysis, obviously driven politically partly by the fear of the debacle of the Clinton plan, and also driven by a polarized national conversation, which frankly has been ignoring important issues and focusing on wedge issues designed to win tactical points in elections. What's going on on the ground in the states is they're responding to the people's demand, make healthcare affordable for me, give me a healthcare system I can have confidence in. Having said that, states cannot do it alone. In both the Massachusetts case and especially in the California case, a great deal of federal money is involved in making their plans a reality. And fundamentally, states like Mississippi, Arkansas, even Kansas, and Iowa, they're not about to do something on those scales on their own. They're going to need federal leadership. What is also true, though, is that state differentiation, state variation should be brought to play. We don't have to have one size fits all, as long as the fundamental structure is individual responsibility in the context of shared responsibility. With national leadership, we can do it for every American. And I think Governor Schwarzenegger and Governor Romney's calls for these things will make it more likely, not less likely, that the national politicians will take this up. As we talked about, those other candidates are talking about it too.
Great. Well, thanks a lot for taking the time to talk to us today, and we'll come back and visit this again.
Glad to be here, Troy. Thank you.
Bye-bye.
All right.